So good morning. I'm Dr. Dale Bratzler. I'm the Enterprise Chief Quality Officer here at OU Health and also the University Chief COVID Officer. I'm going to give a brief update on where we're at in the pandemic right now and then highlight a couple of issues I want to point out that I think are really important as we approach the Christmas and New Year's break. And then I also want to take some time to answer some of your questions. So this morning, the health department updated the number of cases in Oklahoma. We're at 269,276, so just under 270,000 confirmed cases in the state. Sadly, there were 43 more deaths reported today, taking us to 2,283, and we still have 35,000 people considered active infection in the state. The 7-day rolling average of new cases now is at the highest that it's ever been since the start of the pandemic. 3,435 new cases on average every day right now in the state. Within the past week, there were 24,047 cases that were confirmed in the past week, which is a high number, and 155 deaths were confirmed over the past week. So we're clearly not out of this pandemic. We're still seeing substantial community spread. I do have a couple of concerns right now, and a handout will come out to all of you. Basically, testing is down. If you look for the past 3 weeks, the number of tests run in Oklahoma has come down. The positive rate for those tests has stayed very high. It was almost 16% last week, and as of the first 2 days of this week, it's at 14.6%. There have been 88,000 tests reported so far this week. One of my real concerns that I'll highlight in just a moment is that with decreased testing, we may see the case counts come down, but that'll be artificially coming down. I think the people that are seeking tests are more likely to be contacts and people with symptoms, and I know I've had many people contact me telling me that they've had difficulties getting in to get tests done because of limited capacity. So I do have a concern that we need to do more tests. We need to encourage people to keep getting tests and increase our capacity to do so. Hospitalizations yesterday were at 1,728, which is down just a little bit from earlier this week, but we approached 1,800 in the hospital, and there were 449 people in the intensive care unit this week. Yesterday as reported, and again about 25% of the people with COVID-19 in the hospital were in the ICU, and so we can expect to see more fatalities in our state. Just a couple of other points I wanted to make. Again, I mentioned testing. The total number of tests done over the past 3 weeks has been coming down. I think part of that is funding issues. Some of it may have been some supply issues transiently for some labs, but we need to make sure people are still getting tested, particularly if they have any contact or concern that they could be a case, because the way we slow the spread of this disease is identifying those people who are positive and then isolating them so they don't spread the disease. The other point I wanted to make is we're seeing more kid cases. The American Academy of Pediatrics noted that there's been a 25% increase in the number of children who have tested positive between the date of December 3rd and December 17th. And since the start of the pandemic, 1.8 million children have tested positive. I wanted to highlight just a couple of one more key point, and that is, when should you go to the hospital or to your doctor's office if you test positive? Because I had a call with a friend who had tested positive and was instructed to go to the emergency room. And I would say in general, you should not go to the emergency room. And in fact, usually we recommend that you don't go to your doctor's office. We encourage you to call first if you think about it or if you think you may need to, so that they can be prepared. But remember, most people who get this infection do not end up in the hospital. And so most people will recover at home. They may feel like a really bad flu, but they don't necessarily need to be in the hospital. And we certainly don't want people with positive diagnoses flooding our emergency rooms, our doctor's offices, where they could potentially infect other people. So the current recommendations are that you should go to the hospital or consider it if you're having real trouble breathing, if you have persistent pain or pressure in your chest, because remember, heart attacks and other things can occur, new confusion, mental changes, which may be more common in the elderly, but if new confusion, lethargy, can't stay awake, elderly people sometimes will quit eating and drinking if they have the infection. Those are all reasons that you may need hospital care. Certainly, if you notice that your lips are bluish or your face is bluish, that might suggest that you're not getting enough oxygen, or any other event that's acute that might prevent you from taking care of yourself. Remember that stroke has been reported as a complication of this disease. So again, we encourage anybody, if you're acutely ill, seek medical help. Don't delay going to the hospital. But most people who test positive for COVID-19 will recover just fine at home with simple measures such as anti-inflammatories and others to take care of the symptoms. And it's only those who are having real trouble, breathing difficulties, chest pain, mental confusion, difficulty staying awake, decreased intake, that actually need hospital care. Do remember that people who have chronic underlying medical illnesses, older people, are more likely to need hospital care. And in the handout, I've included a graphic that shows that in Oklahoma, if you're below the age of 55, you have a relatively low chance of needing to be in the hospital or to actually be have any complications such as death. But above the age of 85, you have a 31% chance of being hospitalized and about a 12% risk of death. So again, age is a big risk predictor, but also people with underlying medical diseases like kidney disease, liver disease, diabetes, lung disease, they may be at more at risk and may need to go to the hospital if they get sick with COVID-19. Before I turn it over for questions, I just wanted to make a couple of points as we approach Christmas. First, I want to express my appreciation to all of the press, because we do appreciate the fact that you're getting information out to Oklahomans that they need to understand for COVID-19. So I've gotten to know many of you, and I want to make sure that I sincerely appreciate and respect the work that you're doing to get information out. I was put into a position this year that I didn't quite expect, and I've had two goals. Number one is to get science out, get real information, not trying to hype any of the information anyway, but just to make sure that people are aware of the science, and also to try to explain it in a way that lay Oklahomans can understand. So that's a real goal. And so I hope all of you have a wonderful holiday season, and I'll be happy to answer questions.
Lovely. When you were talking about the numbers of people being vaccinated going down, it made me remember that earlier this week somebody called me and said he wanted to get tested, but his wife said that they're now charging $175 for tests. And I said, well, ours are still, through the health department, are still not free. So how?
Yeah, so the question is about testing. Why is the number going down? So there are some labs that do not have CARES Act funding anymore. And so typically I tell people the cost of the test when you go out to private laboratories is in the range of anywhere from $100, can be up to $175. $125 is a common number I hear. And that's going to really substantially reduce testing in our state, which means we will have people who are infected who simply don't go get a test. Our case numbers will come down, but spread of the disease will continue. So it is very important that we continue to test as many people as we possibly can. For those laboratories that still have CARES Act funding, they don't charge anything for the test, and I think we need to expand that. I recognize the limitations of the funding that it costs to pay for all of these tests. I know that some private insurance companies will cover the cost of COVID testing, but that may vary depending on whether you have insurance and what insurance you have.
So I've had a couple of questions about mental health during all of this. So one was about people that work in the hospitals. It's how do doctors and nurses keep their spirits up, especially around the holidays? Does OU Health offer any assistance or programs to help with frontline workers' mental health?
Yeah, so I would say the answer is yes. OU Health does, the University of Oklahoma does provide support for the healthcare workers. We recognize this has been a particularly stressful year in general, and now we have the holidays on top of that. So I think most healthcare workers knew when they got into healthcare that on occasions they would be requested to work on the holidays. Hospitals are open 24/7, and so physicians, nurses who work in that setting have always known that at times they're going to be working on the holidays. So that's not new. But this year it's particularly stressful with the large number of people that are in the hospital with COVID, many of them very ill, as I mentioned, almost a little over a quarter of them in the intensive care unit, many of them on ventilators, and they can't have their families around. And so the hospitals have provided employee assistance, all sorts of additional coaching training. In our physician group, we have peer groups that doctors can talk to. We've offered simple things like chairside massages to help just relieve some of the stress. We have our OU Well program that encourages that our healthcare workers maintain their health themselves. So it's very important. The hospitals are quite aware of it. I think all the hospitals that I'm aware of, certainly in the Oklahoma City Metro, are doing things to help the mental health and the stress reduction for the healthcare workers dealing with a very difficult time right now.
And then on the other side, somebody was asking about the mental health of Oklahomans in general, and our hospitals seeing more inpatients, possibly from self-harm or from other mental health concerns.
Yeah, so the question is about whether the hospitals are seeing more patients coming into the hospital with mental health concerns or even self-harm. I don't know. I haven't seen any specific data on that, on the actual trends. I do know that we've seen through the pandemic alcohol use has gone up across the board, so that may create some challenges. Perhaps some people use alcohol as a way to treat their anxiety or depression from this particular the issues of the pandemic, but I cannot answer the questions about whether we're seeing actually increased numbers of cases of mental health come into our hospitals.
So let's talk about if we've seen a spike in cases after Thanksgiving and what the projection for after Christmas will be.
Yeah, so the question is, did we see a spike after Thanksgiving, and what do we think is going to happen after Christmas? So we did see the number of cases go up in Oklahoma after Thanksgiving. It was a bit delayed, though, a little bit farther than we thought it would be. But as I mentioned earlier, we're at the highest peak of average new daily cases that we've ever been through the entire pandemic. And pretty much since about 2 weeks after Thanksgiving, we've seen that number very slowly, but it's been persistently going up. At the same time that I have concerns that we're not testing enough, and so we may be missing cases, and our case numbers may artificially be somewhat low. I think after Christmas and New Year's, we're very, very concerned. Again, Christmas is one of those holiday events that brings people together indoors for events like family events at homes, at places of worship, and those are places where the virus loves to spread, particularly if you bring people indoors and they don't have their mask on. So we're strongly encouraging people, please don't travel this year. If you have to travel, get tested if possible. Wear your mask as much as possible. Certainly during any travel, wear your mask. Wear your mask if you have family gatherings as much as you can, particularly if you're bringing people into your home that don't typically live with you, because that's how it gets into the home. Keep events small. As I've told several people, I think the worst thing you could do is have a big family around a dining room table without mask, because the possible transmission of the virus in that setting is very high. And then think about the people that you'll be coming together with. The elderly, particularly grandparents, parents, things like that. Think about people in your family that have chronic illness, cancer as an example, or diabetes, because they're at greater risk of the complications if they do get the infection. So I think all of us in healthcare and public health have real concerns that a couple of weeks after this next week, this break between Christmas and New Year's, we may see the case counts go up substantially. So we're really asking everybody to help us. let's get through this year. Let's wear the mask, keep it small, avoid others. Let's keep it small this year. So hopefully, with the rollout of the vaccine, perhaps by next year, we can get back to what we might consider a more normal holiday season.
So Oklahoma's kind of wrapping up the first phase of vaccine distribution with the Pfizer vaccine and dissemination. And Moderna has showed up this week. So can you just kind of give us an update on how that's been going?
Yeah, so we're really excited about having the vaccines in Oklahoma. I know our system through yesterday had given about 4,000 doses of vaccine, and I know that about 66,000 doses of Moderna vaccine showed up in Oklahoma this week, and those are starting to be distributed. We're not through phase 1 yet. Phase 1 includes healthcare workers that are on the front line, patient-facing, particularly those that might take care of COVID patients, and then all the nursing home residents, and I know that just really kicked off yesterday, and it's going to take a while to vaccinate all of those in the nursing home setting, the healthcare workers, the nursing home residents. Very, very important because they're at high risk, and once COVID gets into a nursing home, it can spread really easily. So we need to make sure we get that population vaccinated. Subsequently, we'll move to phase 2. Hopefully within a week or two, we'll be close to getting to phase 2. There may be some communities, particularly small rural communities, where phase 1, particularly healthcare workers, the frontline emergency responders and others won't take too long, and they can quickly move into phase 2, which will include all of those patient-facing emergency workers, paramedics, policemen, firemen, and others that are often put into that circumstance of having to be in a person's face that may have COVID-19, and then starting to get the elderly and those with chronic illness vaccinated. The CDC this past week came out with their recommendations to vaccinate those 75 and over first, to get it to some of the frontline essential workers like food service workers and others who, again, are put in a setting where people come together and don't wear a mask, so they're at high risk of the infection. They can also spread it to older people. So it's a phased rollout. I think it's going to take time. I think it's going to be spring before we're really perhaps even begin to be close to start rolling it out for the general population. But what we're hoping is if we get the vaccine into the arms of those people who are at risk of the complications of the disease, the elderly and those with chronic underlying diseases, we can start to see the hospitalization numbers come down, ICU admissions come down, deaths come down. Even if we're still seeing cases, at least maybe the cases will be in younger people or others that don't get nearly as sick if they get the virus.
Okay. So, of course, we have a question about, is the virus mutating in the U.S. and will the vaccine be effective against it?
Yeah, so all RNA virus, so the question is about, is the virus mutating in the United States? And everybody's heard about the new strain in the United Kingdom. So all RNA viruses mutate. That's common. That happens all of the time. What's happened in the south part of the UK is that the COVID-19 virus mutated quite a bit, 29 different mutations in a single virus, and it seems to be spreading faster. Some of those mutations affected that spike protein, the one you see the picture of that sits on the outside. That's what the virus uses to attach to the human body. And so there were some mutations in that spike protein. Is it in the United States yet? We don't know, but I think most of us in public health feel like it's likely it's already gotten here. Maybe it's not spreading yet, but it's very, very difficult in this age of air travel to stop a viral illness from one part of the world from getting into other parts of the world. And we know that this new virus has already been found in the Netherlands, Denmark, and in Belgium in Europe. So it's fairly likely that it could have gotten into the United States. So it's raised a number of questions about some of the things that we're doing for COVID-19. Number one, will it spread faster? It appears to, at least based on the studies out of the United Kingdom. the patients who get it don't appear to get any sicker. But again, remember, in Oklahoma, about 10 to 12% of the people who get this infection end up in a hospital. So if we have a virus that spreads faster, we could see our hospitalization numbers go up just by sheer number of people. The other question is, will some of the treatments that we currently do for COVID-19 continue to work with a mutated virus? Will monoclonal antibodies, will convalescent plasma from somebody who didn't have that particular virus be helpful in somebody that does get the new virus? We just don't know yet. Most experts feel that the vaccine will still be effective. Most people feel that much of the treatments will still be effective, but time will tell as we see that. But just, I think everybody has to recognize, as we roll out a vaccine and get more people vaccinated, mutations of the virus will likely occur, and it's possible that some mutation could occur that would make the virus spread to people even if they've had vaccine. So time will tell.
Interesting. Okay, I have one question that I just thought of. So we wear masks to keep us from spreading it and getting it, and you cover your nose and you cover your mouth. Can the virus get in through your eyes?
Yeah, so there's some evidence that you might be able to get infected by contamination of the eyes. It doesn't appear to be the major way that people get COVID-19. So as I've pointed out many times before, although we recommend doing hand hygiene and other things, remember the vast majority of people who get this virus get it by inhaling the virus in droplets that come out of somebody else's mouth. So the biggest risk is being around other people without masks, because that's how you get infected primarily. In healthcare, we now require all of our healthcare providers in the clinical setting to wear a face shield or eye protection now, because the CDC came out with recommendations that if you're seeing high rates of community spread of the virus, meaning there are a lot of people who could be infected, they recommended that you use eye protection. So we're doing that now in our healthcare settings. I'm not sure it'll be terribly helpful in the general population, but certainly in our doctors, our nurses, respiratory therapists, and others who are directly in the face of patients, right now we're encouraging them to wear eye protection.
So if you wear glasses, does that give you extra?
Yeah, so there actually are some limited studies that show that wearing glasses may have a limited effect. In healthcare, we don't allow people to just wear regular glasses. They have to wrap around and cover the entire eye.
Okay. Anything else you want to wrap with?
I don't think so.